our esteemed Kwesi, Chief Program Officer at the Institute for Educational Leadership, Hetty Chang, and we'll hear from Elliot Atisha, who is a Senior Fellow for Health. We have a poll going on as we speak that should be up on your screen, so please fill out those questions. Let's go to the next slide. So about IEL, IEL is a 60-plus-year-old national nonprofit that is a longtime partner of Attendance Works. We work with all kinds of communities on transformational strategies to improve outcomes for children, youth, and families. We're the home for the Coalition for Community Schools, and really just grateful to still be able to support folks as they transform their practice. Next slide. Attendance Works, of course, advances student success in school, and operates at the state, national, local levels. The Attendance Works is really the nation's premier thought leader and advocate for addressing all of the root causes and the issues attendant to chronic absenteeism. And since our launch in 2010, we really have been the go-to resource for improving student attendance. Next slide. So we have a wonderful agenda today. You've heard from us. We are going to be addressing key concepts related to attendance, health, well-being, and safety. We'll hear from Chelsea Montgomery, Assistant Superintendent for Student Services in Atlanta Public Schools, Beatriz Barajas Gonzalez, Director of Family Engagement and Cluster Lead at San Bernardino City Unified, Kim Stanislaw, Chief Clinical Officer at the National Association of School Nurses, as well as Heidi Schumacher, who's also a member of the Attendance Works Advisory Board, Assistant Professor of Pediatrics, Vermont Child Health Improvement Program, University of Vermont. So really an esteemed panel, and then of course we'll have a wonderful dialogue, Q&A, closing reflections, offer some resources. Next slide. Thanks again to our convening partners for this year's Attendance Awareness Campaign 2025, Campaign for Grade Level Reading, Communities and Schools, Everyone Graduates, Learning Heroes, Future Ed, Healthy Schools Campaign, Mentor, National League of Cities, and United Way. And you can see a full list of partners, next slide, at the national and state level at the Attendance Awareness website. This is the second of a series of 4 in this year's campaign. Here today, ready for tomorrow. You can see the others. Encourage you to register for the entire series, and even if you can't attend, you'll be sent a link to the webinar so that you can view it later. Next slide. Here are our key actions and messages for educators and partners. Embrace a problem-solving approach, engage parents and guardians, create safe, engaged learning environments, support health and well-being of students, families, and staff, and involve the whole community in your strategy. Next slide. We also want to thank campaign sponsors for supporting this particular webinar, Kaiser Permanente and Raw Week 12, Attendance Plus. Next slide. And all of this is made possible through generous support from individuals, from corporations, from foundations, and other means. So for the price of a cup of coffee, you'd be surprised how much support you can give. Think about all that good Starbucks coffee. Just one less cup a week will help keep this work going, critical work for our country. Next slide. Here today, ready for tomorrow. That's our slogan. Fully embrace it. Feel free to share it. We have resources attendant to that on the website. Next slide. And obviously, our slogan highlights the role that schools play. We know that we can't achieve our hopes and dreams for our kids without good school attendance. Empty seats don't learn, so they certainly don't achieve. Here today, ready for tomorrow emphasizes the link between regular attendance and a well-prepared next generation workforce. And with the next slide, I'm going to turn it over to our illustrious leader, Hetty Chang, who's going to bring us up to date on what the chronic absence crisis is in this moment. Hetty?
Thank you so much, Kwesi. What a pleasure to be here and with all of this amazing interest in this webinar, because you all know that um, making sure that kids show up every single day is a common ground issue that we all care about, and it matters for health, well-being, safety, both short-term and long-term. But it helps to ground ourselves in this context. So we have a national chronic absence crisis that, during the pandemic, chronic absence nearly doubled. It started to go down a little bit last year. State data shows that it still went down a little bit further in 2024. We don't yet know what's happening in 2025, but we do know that unless we pay significant attention to this issue, work on how we address it, we're not going to get to where we want. And if you go to the next slide, what we know is that addressing chronic absence requires us to start in kindergarten, because for years, chronic absence has been a little more elevated in the early grades. Then it starts to get higher, particularly in then the middle and the high school grades. But if we don't address this crisis starting among our youngest kids, what we don't invest in now, we will pay for later, because they don't have the skills, the habits, the supports that make sure that they can succeed in life. Now, we still have to address what's happening with our older kids, but we need to make sure that we're starting and then continuing all throughout our kids' careers. If you go to the next slide, what we know is that when we've seen these high levels of chronic absence, it's really an erosion in these positive conditions for learning. It happens when kids don't feel physical, emotional health and safety, belonging, connection, support, academic challenge and engagement. They're not surrounded by adults and students with the well-being to invest in those relationships that are so essential to making sure that kids want to be in school, feel they can be in school, and are drawn to school, and can reach out and get the supports they need to address the barriers that might prevent them from getting to school. But that top circle is physical, emotional health and safety. And that's a huge focus of today's webinar. If you go to the next slide, we know that what we have to do is we have to first invest in those positive conditions of learning and then layer on these tiers of support. That's what's going to get us to where we need. And if you go to the next slide, what we know is that the way we're going to turn this around is when we identify and address the root causes of chronic absence. Are they barriers? Particularly, some of these barriers are bigger in our low-income communities. But is it aversion? Is it disengagement? Is it misconceptions? And health can affect all of this. And with that, I'm going to ask my colleague, Dr. Elliot Tisha. Elliot, please take us through, what do we know about health-related barriers to kids getting to school?
Awesome. Thank you so much, Hetty. If we could advance to the next slide, please. Thank you. I'm super excited to be here. A quick note to the audience, keep an eye on the chat for one or two of my punny dad jokes. A healthy learner starts with a healthy student. Sadly, many of our kids are dealing with poorly controlled health issues, which influence their ability to learn and attend school. And this slide highlights the more common health-related barriers to learning, such as asthma, behavioral health, vision problems, and dental issues. Asthma and dental issues have historically been leading contributors to missed school days, and both are more prevalent in poor socioeconomic areas. Behavioral health issues affect about 20% of children and have only spiked post-COVID. But due to stigma and barriers to access, many children do not receive the necessary treatment, so no surprise that they're twice as likely to miss school. Next slide. Youth risk behavior data shows that about 40% of students reported feeling sad or hopeless to the point where they stopped doing usual activities, with females significantly outnumbering males and over 2/3 of LGBTQ students reporting similar concerns. And this is all compounded by the fact that many students don't feel safe and connected, with about 1 in 3 students saying that they didn't feel close to anyone at their school. Where does that leave motivation to attend? Next slide. There's also a strong connection between mental health and academic performance, with students who report lower grades at much higher risk for symptoms of depression or suicidality. One data point that keeps me up at night is that students who receive mostly D's and F's are 3.5 times more likely to report attempting suicide as those mostly with A's. But on a more positive note, we know that healthy students are more likely to attend school, stay engaged, and be ready to learn. And these same students will be more likely to graduate and live healthier, more fulfilling lives. Next slide. Improving attendance starts with a whole child approach. It requires foundational support, such as policies around school climate and connectedness. It prioritizes prevention through health and physical education, screenings, and resources. It requires collecting health data and sharing it with need-to-know individuals. It leverages Medicaid dollars to support evidence-based school health services. Every school should have a school nurse. As health experts in school setting, they coordinate student health needs and they help keep kids in class. Who remembers theirs from their elementary years? School-based health centers also keep kids in school, providing comprehensive on-site health services. Having a school-based health center, though, doesn't mean that a school nurse isn't needed. They perform separate but complementary roles. And as we saw from the data, behavioral health services are also and especially important. By creating trauma-informed schools, we can recognize and respond more quickly, reduce suspensions, improve attendance, and overall school performance. And I'm biased, of course, but school health physicians also play a tremendous role in supporting schools and districts as we do this work. Other best practices include a focus on employee wellness, community schools, home visits, and after-school programming such as arts and athletics. Look out for my dad joke in the chat. Next slide. Schools obviously can't do this work alone. We have to make sure to align the intervention to the reason and then find the partners to address it. We must have the infrastructure in place to make the partnership successful. This includes information sharing agreements to help ensure coordination of care. If we make a partner referral, did we close the loop on connecting the student and family with the service? We must also make sure the intervention is readily accessible. In my previous role at Detroit Public Schools Community District, we worked with the Detroit Health Department and Vision to Learn to conduct vision screenings and provide free glasses to children who needed them. By switching from opt-in to opt-out consent, we went from 50% of kids who failed their screening receiving glasses to 98%. I share this not to brag, but to highlight the importance of ensuring policies improve access rather than unintentionally hindering it. We'll hear more about specific interventions and the strengths of such partnerships from our panel. Next slide. So as you begin to think about the next school year, with a small pause to think about summer, we've put together some immediate health-focused actions to improving attendance. And this starts with prevention. This includes supporting relationships and creating healthy routines and habits at home and school, while maximizing access to school-based health screenings, such as vision and dental, behavioral health, vaccines, food and housing insecurity. It also includes messaging on the importance of attendance routine and when a child should or shouldn't stay home. During the pandemic, we saw families struggle with this, many times keeping kids home unnecessarily. Messaging must be evidence-based and available in necessary translations. It includes making sure the attendance team draws on different areas of expertise, including school health team members, allowing for early identification of health issues and improved coordination. And it also includes knowing the student health body needs and how they might be creating barriers to attendance, making sure students with chronic health issues and disabilities have individualized health and education plans so that families feel secure sending their children to school. Next slide. Attendance Works, in collaboration with the National Association of School Nurses and Kaiser Permanente, has developed a few resources which can help put these actions in place, offering guidance on how to keep children healthy and in school, when or when not to keep a child home, and how to identify and respond to children who might be dealing with anxiety. We will soon also launch a resource on chronic health issues. And some suggested methods to share these resources include back-to-school packets and parent and staff meetings. Next slide. This short video shows the attendance team in action and highlights the role of social workers and school nurses.
It's not necessarily targeting individual kids. It's targeting when there are patterns present in your school community that are affecting large numbers of kids.
Talked to his kids actually, and he is doing a lot better as far as getting to school. He's at 94% attendance.
I think the biggest systemic change was putting the attendance team together.
So devise the plan and then follow through. Get the right people on the team who can move the plan.
Trust is one.
And then make sure you follow up, follow up, follow up.
Our attendance team consists of our attendance clerk, our truancy officer for the district, the teacher on special assignment for our school, and our school psychologist.
Good morning. Hi, Bridgewater.
Ours includes social workers, admin, and our student support person. And so then that expands to investing teachers who might have a relationship with the child to do the home visit or to do the outreach.
When I said I needed an attendance team, we needed to be able to work together on attendance, then everybody wanted to, join in. The nurse said, I'll do this. And the counselor said, well, I can do this. So that's when my nurse got in it and she started saying, well, I'll call parents and just let me get those that are missing or absent and I'll start calling. We'll see what's going on.
Thank you. So if you include health staff on your attendance teams, please share a note in the chat. Next slide. In collaboration with the American Academy of Pediatrics, we developed a learning burst that reinforces many of today's messages. It describes the major causes of absenteeism, offers interventions, and discusses how schools and healthcare providers can tag team on improving attendance. Included are some slides and facilitator speaker notes that school health staff can use to conduct team trainings. Next slide. So multiple organizations are also engaging in messaging about making attendance a vital sign. When a child visits the doctor, vital signs are the first thing we check. If they're normal, we provide reassurance. If vital signs are outside of normal, we dig deeper to find the cause and then provide the necessary intervention. Knowing the connection between health and attendance, we must also include attendance as a vital sign. If a child's attendance starts to drop, is it due to a health issue? Is there an underlying social determinant of health? Is something happening or not happening at home and or at school? Is there an intervention that can help get the child back to class? Hetty knows that I can talk about attendance all day and in my sleep, but my time is up. I'm especially excited for our panel today to share their knowledge and expertise on how we can work together to keep our kids healthy and in school. And one of them happens to be the author of an article on this slide. Before I go, did anybody get my dad joke?
So, Elliot, I just wanted to mention you had a couple guesses. The dad joke was, why don't you repeat your joke?
Yeah, so what's the alligator's favorite after-school activity?
So 2 responses were drink Gatorade, swamp and seek. And what is the answer, Elliot?
Oh my goodness, I love those. Those are going on my list. The answer is, drum roll, marching band. You guys can ping me for a free consult on dad jokes.
And then the only other thing I just wanted to say in between, that there were a number of people who talked about bringing in school nurses. They do have them at the team. They also talked about some of the challenges and not necessarily having full team. So Kim Stanislow, stay on guard. These are going to be issues that will come up for you in particular as well. Thank you, Elliot. Dr. Atisha has been an amazing member of the Attendance Works team, helping us to really deepen our work on health, well-being, and safety. And it is now my pleasure, if we go to the next slide, to introduce our panelists. So we're going to start off with a couple of our colleagues who will bring in what does it mean to do this at the school and district level. So we'll have Chelsea Montgomery, Assistant Superintendent of Student Services with the Atlanta Public Schools. That's Georgia, in case anyone didn't know where Atlanta was. And Beatrice Barajas Gonzalez, she is the Director of Family Engagement for the San Bernardino City Unified. San Bernardino City Unified is out here in California, so if folks weren't sure where that was. We will have them talk first about what they're doing, and then we're going to have Kim Stanislow with the National Association of School Nurses, and Heidi Schumacher, who is an assistant professor of pediatrics, but also very involved with AAP and their COSH committee, Council on School Health, be able to bring up what does it mean from nurses and pediatricians, and how do we involve our health professionals in this work? But with that, I'm going to turn it over to Chelsea. So first of all, Chelsea, just give us quick, brief background. Let's go to the next slide. Just in case folks don't know much about Atlanta Public Schools, tell us a little bit about it and what have you seen in terms of attendance and chronic absence?
Sure. So good afternoon, everyone. So we are Atlanta Public Schools. We are the school system that makes up the city of Atlanta. I included the metro area on the map so you can kind of see who our neighbors are. We are cut out of Fulton County. We are about 70% free and reduced lunch. We have approximately 50,000 students, about 40,000 of those being in our traditional schools and about 10,000 in our charter schools. We are 70% Black, 16% white, 8% Hispanic, and then the rest of the demographics and diversity is there. We have about 59 schools, and we have approximately 4,200 teachers. So we are a very diverse district, and we are in the heart of the city.
And what have you seen in terms of chronic absence recently?
It's getting better slowly but surely, and we'll share that data in a minute. But as far as chronic absenteeism, we are seeing slight improvements. We continue to just chip away slowly. We are working towards making sure kids are in person in school. We don't have any virtual options or anything like that. We want to see children's smiling faces in our buildings every single day. So we are trying to get kids back. We are also doing a lot of heavy work tackling those relationships and filling the mostly socioeconomic needs of our families, considering that we are that 70% free or reduced lunch status.
Great. And can you just show the next slide, please? I think that gives a little bit of your data. I don't think it moved yet. So
yes, there we go. So yeah, so we are making steady improvements. We are a rate of between 1% to 2% per year, but steady on that track. In the last 3 years. So if we look at student attendance in bands, that'll make a little bit more sense in a minute why we do it that way. So we look at low risk is students that are present for 94% of enrolled days. Risk students 90 to 94%, and then does not meet is that chronic absenteeism lane, which is about at that point is less than 90%. So in school year 24, we saw a reduction for 1,047 students. Percentages are great, but I like to see raw numbers of actual kids that we're impacting. And then so far this year, we hope this number stays steady, but we've reduced it again on 2,426 less students falling in that does not meet or chronic absenteeism band. So slow and steady is the name of the game in improving our chronic absenteeism and attendance rates.
And so, Chelsea, tell me about your role in the district and why you actually care about addressing health, mental health, in order to improve attendance.
Well, at the end of the day, anything that we do is lost efforts if the child is not present. So attendance does come first and foremost, in my opinion. And as far as health and mental health, so in my department, we have our health services team and we have our counselors, psychologists, social workers. Hospital homebound really comes into play when you're talking about students sometimes that are struggling with mental health or may even be hospitalized or in and out of treatments. So kids are complex. They don't work in one silo or one bucket. So coming together as a team at the district level has been incredibly important to also then have that cascade down to the school level.
So tell us about your top strategies for actually addressing attendance by really employing health-related, mental health-related strategies.
Yeah, so if you want to go ahead, if you can go to the next slide. So I am still a teacher at heart, so we're going to explain my strategies with a little bit of an activity. If everybody could just write down the name of a student that you're thinking of that's really struggling with attendance on a piece of scrap paper that you have laying around. I want to stay grounded in an actual child and in children today. So when you think about the name of that student, and thinking the teasing out of academics, attendance, behavior, mental health, how many of these categories is that child struggling with? Are they not coming to school because they're struggling with their mental health? Is their behavior and discipline, and are we actually suspending days that then impact their attendance? Do they not want to read and they're really struggling in math? Think your high school kids, the COVID years of those critical skills. I see lots of things over there, all categories. That is common. Kids are complicated. So that is kind of those squiggly lines on the right. That's really getting at when we think of our teams, we have to come together. And yes, physical health is absolutely part of the puzzle as well. Thanks for calling that out, because we do that work too, but that's exactly why this is complicated. So going back to the question about the strategies, if you can go to the next slide, I can talk about what some of those look like on the ground here in APS. So I'm going to talk, and other groups are going to talk a lot about physical health, so I'm not going to touch as more on it as some of our other panelists. But in the mental health space, we do signs of suicide, grades 6 through 12 here in APS at Tier 1. We also have something called Talk It Out. There is a low-cost way to get this support for our kids. So this is mental health support, but not quite therapy. This is kind of stigma breaking work. So any student in a traditional school in APS can text a phone number, and a clinical licensed clinician will respond in under 2 to 3 minutes and just have a text conversation with them. So that's either, you know, a huge test coming up, a bad breakup, I don't want to see my ex-girlfriend tomorrow. Those things really matter. So we have that support there available for kids to talk it out on demand with a licensed professional. We also have small groups at Tier 2, so we use research and evidence-based curriculums. Our counselors, psychologists, and social workers, they pull all of those Tier 2 groups. And then at Tier 3, we have a mental health partner identified in every school. I could talk about this one all day long, and how we have constructed that and adjusted that with those mental health partners. So we do have therapists available in every school with our partners. And then some of our schools have even opted to hire their own clinical therapists as well. We do that here in APS. So those are some of the mental health strategies. Some of the physical health strategies, we are very lucky, especially in the Southeast. We do have a school nurse in every school. That is a gift in the South. So we are very proud of that. And they are key participants in making sure our kids are healthy and in school every day. We have 5 school health clinics currently. And as Elliot talked about, those are really important. We do a lot of immunization support. Immunization can be a huge barrier, not only to attendance, but to enrollment. So making sure we get the immunizations to our kids is something we really lean into. Vision programs. I've seen some shout outs for Vision to Learn in the chat. We work with Vision to Learn. We work with the Lions Club International and with Prevent Blindness Georgia. And I'm excited to say that next year, all of our elementary Title I schools will have free screenings, exams, and glasses for our kids. So that is a big one. We're very excited about that. We provide feminine hygiene products. People don't always think about that, but that's a real barrier to attendance if you can't afford things like that. And there are a lot of grants and resources out there to make sure you provide those. We have an APS Student and Family Support Hub where all of our families can access all of our supports, but we also have a department store in there. We have a grocery store, and then items like food, household cleaning, and personal hygiene items. And then last but not least, this is a free resource unless you want to customize it for your district. If you do not use findhelp.org, I 10 out of 10 suggest it. It is an incredible resource to help families find resources and organizations close to their house that meet their needs. You don't need to keep those giant lists anymore of all of the resources in your area. And I'll put the information in the chat. If you do not use Find Help, highly suggest. And then I'll put it in the chat, I promise. And then the next thing is safety. And we think of safety pretty explicitly here in APS. So we have a Say Something Anonymous reporting system. If you do not have a reporting system in your district, Sandy Hook Promise does provide one for free to make sure we report concerns. We even lean in. We have events where we hand out car seats. We have events where we hand out gun lock boxes at home. We have a threat assessment. I would have never loved this 5 years ago, but I am absolutely all in. We do weapon screening here in APS. If people feel safe, they'll come to school. We have some safe passage programs where we have adults in the community make sure our kids are getting to and from school safely. We also have an off-site suspension program where if children have suspensions, they can go to a safe place where they also get connected with all kinds of resources. And it's also pretty cool where they can go and serve those days. And then we are very fortunate. We also have SROs in every school. So that was the speed version. I will go back and answer questions in the chat.
Chelsea, I'm going to ask you one quick question and then I'm
Yes.
going to have you ask the other one. What SIS system do you use to partner to create your data reports?
So we have Infinite Campus. We also have homegrown reports and, Tableau, SharePoint, whatever you use, Power BI. And then we also do work with Everyday Labs and use their dashboards and reports to help us with our notifications and really kind of knowing where to go.
Great. I'm going to just let folks know. Chelsea's going to answer in the chat. We also are going to have a cross-cutting set of questions. So we see some great questions, but the ones like about the Google Classroom one, I can see relating to other folks. So we'll get to that. I would now like to turn over to Dr. Beatriz Gonzalez. Beatriz, thank you so much for joining us. So let's start and then let's just give a little bit of sense of who is, well, can we go to the next slide? San Bernardino, we're actually wanting to just give people a little sense of San Bernardino's district. And Jaden, please go to the next slide.
Hello, everyone. Very happy to be here with all of you. My name is Beatriz Gonzalez. I currently oversee the Family Engagement Department and the Community Health Education Worker Program, also known as the CHU program that I'll be talking about today. And just know I'm very happy to be here. And just know that we really do focus on students overall. We focus on health, education, and outreach as well. And so I want to start by telling you a little bit about our amazing district. We currently have a little over 46,000 students, actually almost 47,000 students. We have 73 schools, so we're fairly large, similar to Atlanta. And we have 6 community schools. 60% of our students are Hispanic Latino. About 10% are Black African American. We, like I said, are amazing. Our students are amazing. And we currently have 21.5% English learner students that are currently enrolled. And again, we're a large district, so chronic absenteeism is very dear to our hearts.
Can you tell us a little bit, I think we want to go to the next slide, about what you've seen happen with chronic absence?
So interestingly enough, we do have a program, and I want to acknowledge that that specifically deals with chronic absenteeism. It's our Positive Youth Development Program or department. They're specifically focused on attendance. And so I went over this information with the director, and it was very eye-opening for everyone to note that pre-pandemic, we were at 18% chronic absenteeism. But then during the pandemic, we jumped up as high as 53%. And so we've been working extensively to reduce these numbers in partnership with other departments, including the Positive Youth Development Department, that I wanted to acknowledge because I did see some of our team members here today. So we've all been working together to reduce the numbers. And right now, we were currently at 29.3% last year. So the numbers are going down, but like mentioned earlier, they're not going down to pre-pandemic numbers. And so we're all working together to make sure that we decrease these numbers together.
So, Beatrice, you're the director of family engagement. Why, as a director of family engagement, are you concerned about addressing health and mental health related needs and attendance?
So that's a great question. Addressing the physical, behavioral, and mental health of the students is integral because we definitely want to make sure that we set the stage for student academic success and really focus on the student overall, right? And so in San Bernardino, all these different aspects are closely linked together. And so we see how family engagement definitely is impacted or impacts student attendance. So we make sure that we blend the two together. And we want to make sure that we address the different challenges that students are facing, which include chronic illness, anxiety, depression, everything that we're going to see in a little bit, tends to diminish participation in school. And so these issues are issues that families bring to the table all the time and definitely lead to chronic absenteeism, disengagement, and eventually academic decline. So we want to make sure that we proactively address all of these health concerns and that we empower families to support their children, academically and physically. So just
I can imagine also if you actually offer concrete support, like around health, mental health to a family, their levels of engagement and their trust in you probably goes up pretty significantly because that's a pretty concrete support.
Yes, we're actually very fortunate to have amazing trust that has been built with our families as a result of the pandemic. We actually see the pandemic as a blessing because it really definitely allowed us to build those relationships and that trust. And so we've seen how that's allowed us to support and to really diminish chronic absenteeism as a whole.
Thank you. So let's go to the next slide and tell us a little bit about how your family engagement department operates and how is health, mental health related needs addressed as part of your work.
So we'll start off with the challenges. San Bernardino City is unique in many different ways, but one of the just challenges that we continue to face as a county, not even in the district, but as a county as a whole, is with regards to chronic absenteeism. And you'll see some numbers here on the slide, but what really stands out is our Pacific Islander population. They have the highest chronic absenteeism rate at 43.5 or 46.9. And then we also have our African American students at 43.5 and our socioeconomically disadvantaged students that face higher chronic absenteeism rates as well. And so these rates within themselves are across the county. This is not just San Bernardino City specifically. We also have, huge challenges with mental health. And you see the numbers there. We have challenges with homelessness as well, and social anxiety and school refusal. We have many students that are refusing to come to school as a result of the pandemic. And so we're really struggling with that to the point where our district decided to continue with the virtual academy. And so there's different ways that we're addressing it. If you go to the next slide, you'll see how some of these challenges, again, are not specific to our district. They're actually countywide. And so this next slide will, if you can turn to the next slide, will tell you how we address these challenges. And so we have, again, I talked about our positive youth development program. They're specifically focused on attendance. We also have a student wellness and support services department that provides support to the students specifically using the multi-tiered support system of support. And we also have mental health providers that collaborate with our department. We collaborate with the Department of Public Health, and they offer counseling, crisis intervention, workshops to our students, and just different services are also offered to the families. And unique to our district is something that we're very proud of are the different, well, they're not unique to our district, it's actually unique to the state of California, are these wellness centers, and the district has invested extensively in ensuring that these wellness centers are available at the different comprehensive high schools. So they provide accessible mental health resources. And then we do have something that's very unique to our district, which is what we're going to focus on today, which are our CHOOS or community health education workers. So these are all different strategies that we have in place in the district to address those challenges that I mentioned before.
Thank you so much. I just want to put a word in. If you want to ask questions, there's Q&A. It's going to be easier if you put the questions in the Q&A, and then we will come back to that as we continue. So tell us more about CHOOS and how this all works.
So if you go to the next slide, like I said, our district is so large, and because of its largeness, we were forced to split into smaller systems called clusters. So we have 73 schools split into 7 clusters, and each cluster, as you can see, has different people that are supporting, but at the bottom, you'll see a little green circle, and that notes the different CHOOS. The CHOOS are community health education workers, and I will be speaking more specifically about them in the next slide. And so community health education workers were established in 2017. I inherited the community health education worker system in 2019. It is a partnership with the community, with San Bernardino City, Loma Linda University Health, and a nonprofit El Sol Neighborhood Educational Center. And so this model was grounded in evidence-based practices of community health workers. Most hospitals, from what I understand, have community health workers. And so we added the education piece. And so what that means is that it was tailored to fit the school system. And I'll go a little bit more in depth into what that means. But I really do want to focus on the research. We used evidence-based research, again, from the community health workers that are in the health system already, but we also use family engagement research. We use the research from Karen Mapp, from Ishimuro, all of this basically showing us how important community is and how much community matters in order to support with chronic absenteeism. So partnerships matter. And so we made it a point to partner with our local university, and hence the community health education workers developed. And so the 4 overarching goals are listed below. Our first goal is to build efficacy, self-efficacy, but also family efficacy. Our second goal is to close understanding of the community, to link, families to services, students to services, and to provide outreach, community education, and advocacy. And so those are the 4 overarching goals of the community health education workers. And again, their main function is to provide full wraparound services to our families, not just to our students, but families, because sometimes students are unable to attend school because they have, a family member to take care of, and so on and so forth. So we make sure that we provide different services to family members as well, in order for students to eliminate all the barriers and be able to return to school. So if you go to the next slide, it talks a little bit more about these services. They're preventative and restorative services. So again, full wraparound services and support are provided. These services include anything from health, well-being, safety, and behavioral and health education. We partner with every single resource available in the community, if possible, in order to provide these services and support. Our main function is to build that bridge between the home, the school, and the community. And again, that's all based on Ishimaru's work. If you're familiar with Ishimaru, she's amazing. And she talks about building those parent brokers or those community brokers. And this is a part of that system and that research. We provide home visitations. That's the biggest key to our success. During the pandemic, the CHUs were out there in the community providing devices, providing hotspots, anything and everything that the students needed in order to not miss school. And so they continued with that. And again, it's preventative. If the student, has some type of illness, or somebody in the family has some type of illness, we make sure that we send a CHU out to ensure that the student has all the resources. It's also restorative. If the students missed over 10 days, we make sure that we send a CHU out to ensure that these services are provided. There's resource navigation and bridging if they need access to Medi-Cal, to any type of insurance, any type of referral, they provide that as well. We have a weekly food distribution and monthly diaper distribution where millions of diapers have been distributed. And again, the medical referral. But all to say that it's a strong partnership with Loma Linda University, and they provide workshops to our families. They do everything and anything, again, to provide those wraparound services to ensure students are attending school.
Beatrice, there's a question about multilingual learners and kids with disabilities having higher levels of chronic absence. And are there policy things that create particular barriers to getting them access to healthcare that you've unpacked through this work, given your population?
I'm going to be 100% honest with you. Whenever I talk to a CHU, there are no barriers. There is nothing that limits them. They will find anything and everything possible to ensure that these students are back in school, regardless of their disability, regardless of their language. And some of the CHUs speak Spanish, some of the CHUs don't. They represent the community. And if there is a need for language interpretation, any type of language support, the CHUs will find someone that can provide it if they can't do it themselves. So there are no barriers. As impossible as that seems, the CHUs are out there to serve, and they've just had amazing results. And I strongly feel that they are one of the reasons why our chronic absenteeism rate has dramatically gone down.
And to be clear, chronic absence in California includes medically excused absences. It's excused, unexcused suspensions. That was a question, but I'm gonna just stay in. And one last question before we now turn over to Kim. Has the fear of deportations affected attendance rates in your district?
It goes back to the trust that you talked about earlier. There was an initial fear and we addressed it. We had town hall meetings with the families. Our superintendent actually invited different lawyers, the Mexican consulate. And again, it goes back to building relationships and having, trust with your families. And so we had a hybrid meeting, and those that felt comfortable came and attended the meetings, and those that didn't joined us via Zoom, but we provided all the resources to the families that they would need. And it dissipated some of that fear that was there. And now our families, we haven't lost any families to, we haven't to the fear, if that makes sense. Our attendance hasn't diminished in our workshops. We still feel that the families are there, and there has been immigration raids, and there have been raids across the just nearby, but the families are still attending. They're still here. They're still present. And again, back to the trust and those relationships that have been established. They feel comfortable. Our superintendent sent out a safe zone letter as well, and so our families feel safe.
One last question, and then we'll have to answer some of the other ones. I'm going to encourage you to answer on the chat as well. But who are the CHUs? Are they nurses? Are they social workers? Who are these folks?
They are community members that have been extensively trained to provide these wraparound services. So they have different experiences and backgrounds, but the key with just the success of this program is that they represent the community. So they have high school diplomas. Some of them are going to college and some of them are becoming nurses, but that isn't a requirement. What's the main requirement is that they have a heart and passion for the community. And so we take on anyone and everyone. Mind you, we only have 7, but we take them on as long as they have that heart and that passion. And no, they aren't district employees. It's actually a contract. It's a partnership that we have with the university. Mm-hmm.
Thank you so much. You're going to come back. I am now going to ask Kim Stanislow if you might join us. So Kim, why are school nurses so essential to this set of work, to attendance, to
Thank you for asking, Hetty. I appreciate you including the school nurse voice in this conversation. And a healthy child is a better learner. But in order for those students to learn, they have to be in school. So access to school nurses is an equity issue, not only education equity, but also health equity, because you can't have one without the other. And school nurses are leaders who bridge both healthcare and education and are key to addressing the needs of the whole child. We are the first and last line of defense, often with student health and engagement. School nurses have the expertise to assess students to determine the underlying causes of any complaints they may be having during the day in their visits. And some of these visits might be quite frequent. And school nurses are a trusted staff member, and the clinics are seen as a very trusted and safe place. And most of what we do centers on keeping that a trusted and safe place. And school nurses, as that first contact, are often the first to identify symptoms that may lead to undiagnosed conditions. So we do a lot of referrals to outside healthcare providers to identify, is there a bigger issue to these complaints? And when we find that students stop coming to the clinic because they feel like they're not being heard or not being addressed, and their needs are not being addressed because they're not always asking for the need that they're coming for, these students tend to become disengaged, and that's when they are at higher risk for chronic absenteeism. And school nurses are an untapped expertise on attendance teams. We are very valuable in addressing and identifying chronic absenteeism and its role with students with chronic conditions. We contribute to reduced rates of absenteeism. We increase the trust that parents have in schools. And we give educators and administrators time back to their day where they then have more time to do their jobs, which is the teaching and the engaging. And school nurses help give money back to the district. We are a return on investment. For every $1 spent on school nursing services, districts will see a return on investment of at least $1.67 and up to $2.20 when we look at medical costs and lost productivity due to parents and teacher loss of work time.
Wow. And I love the slide, just concretely naming some of these benefits. So I want to now talk a little bit about roles. So these are all the things you can get from having a school nurse. What are the roles that school nurses can play?
Next slide, please. Now, we're going to take a closer look at these 6 strategies. I will say this is not an all-inclusive list, but hoping to provide you with a little bit bigger picture of the role and expertise of the school nurse. Now, communication. Every staff member does communication. What this looks like for the school nurse may be a weekly newsletter or a health tidbit in a bigger school newsletter. It may be health presentations to students and families at parent-teacher night, or the daily conversations we have with students and families and outside healthcare providers to better engage and ensure that students are safe and they have what they need. And every opportunity we have to talk with students and families, we are continuing to build that trust. And there is always a little bit of education in there. And specific to parent outreach, we are seen as a very trusted and non-punitive source. So when we address attendance, it's often seen in a different light than when an administrator may call. Education, every chance we see a student, we are teaching them, whether it's a healthy habit, whether it's a new coping skill, whether it's, helping students with chronic conditions like diabetes, how to better care and gain skills to manage their own care, because it's their lives, they have to live with it. And they're more likely to come to school if they're able to provide their own care and understand how that fits in. We provide staff training so that all students can be safe in their classrooms. And this may also be field trips, playgrounds. Staff need to know how to provide emergency treatment if needed for student health needs. And the clinical care. Obviously, this is where most think school nurses, this is all we do, the Band-Aids and ice pack. I will tell you, in my 20+ years as a school nurse, that Band-Aids and ice packs are maybe 10% of my daily work, or what I did, or what I don't do that now working here at NASN, but in a school. So it is very much all of these other things. But we do provide, and we are there to provide care for both acute injuries and health complaints, as well as those chronic conditions. Every student deserves to be educated. Students have many needs, and schools have to be able to provide those needs. We are there to coordinate those as well as help provide them. And for the policy and procedure, most of what we do in this area is related to review and recommending evidence-based practices, keeping up with those practices and how they apply to school policy. We saw this quite often with the ever-changing policies and recommendations in COVID, but we also see this with immunizations, vision and hearing screening, when to keep your child home, or when your child is not too sick to come to school and they should be in school. And that policy implementation, that it's standardized across buildings. And school nurses also help schools fulfill their child find requirement, which means that schools are responsible for identifying students with disabilities, as well as those that may have undiagnosed disabilities. that they all have access to learn and access school. And this is very important, particularly around the chronic absenteeism, because the Child Find allows us to better investigate and identify possible complaints or things that are going on health-wise that maybe the parents and students aren't even sure how to verbalize. We do a lot of the care planning under coordination, emergency planning, everything from how to make sure students get their insulin on field trips, or the yearly 8th grade trip to Washington, D.C., how to pull everything together from home care and school care and send the teachers packing with what they need to care for students for 24 hours a day for 3 days. And we really work to build those community partnerships so that the resources are there, not only for the students, but for the families and the schools. And data collection may not be the first thing that comes to your mind with a school nurse, but every decision we make is informed by data. We document the care we provide in a health record, just as outside medical providers are providing them in their own health records. And that all provides data. We have data on, trends related to student complaints. Are they going home? Are they going back to class? What care are we providing? What are the gaps? Where do we need help? And also some of those social drivers of health that, whether it's lack of transportation, whether it's having difficulty with health insurance or finding a specialized healthcare provider, we know those things and we have those resources to hook families up.
Wow, that's a lot of different roles. So what is your advice to folks about how do they best utilize their school nurses?
Next slide, please. Well, looking at all of those strategies and more, school nurses utilize these strategies on a tiered approach, much like all the other school staff and team members do, to complement and supplement their interventions on a tiered approach. And the utilization of these tiered approaches, the basis is on prevention and early intervention, and each of the tiers build upon each other. This is critical because without that strong foundation, it's harder to provide and keep the students in the lower tiers because we don't want them progressing up the pyramid.
So Kim, what I'm hearing is that a lot of times we think about using school nurses really at tier 2 or tier 3. It's almost the case where the kid's already having medical challenges and then we're using the school nurse. And your suggestion is we really need to think about them at that prevention stage in the universal tier 1 strategies.
Correct. And I would say that's probably where we're most valuable. The presence of a school nurse communicates to a school community that the link between health and academics is a priority. The school nurse is a visible representation of a healthy and safe environment, and that all student needs will be met. In the foundational level, school nurses will be involved in interventions such as those daily interactions. Again, it's those students who may be coming to the clinic frequently. They have a need. It's typically not the need they're asking for, or it's, giving that smile to the student in the hallway, or standing at the front door when they come in and making sure, the students know they matter. It matters that they showed up today. We're one of the staff members who likely see a large majority of all students in any given week, particularly a school year. But we have quite a wide reach. And again, we are a trusted place, and they know that.
Thank you. That's so helpful. I'm now going to shift over to Dr. Heidi Schumacher. Thank you, Heidi. And thank you, Kim. We're going to come back and we'll have a little bit of cross-cutting conversation, but I want to make sure that we have a chance to hear from Heidi, who is a pediatrician and also a member of the Attendance Works Advisory Board. We're so glad you could help us and present. Heidi, can you start? And so let's maybe turn off the slide for just a second. But why did you decide to tackle chronic absence? You're a pediatrician. Why does this stuff matter to you?
I love this question and I get it often. And I think it's a really easy answer. It's because of the incredibly close bidirectional relationship between health and attendance. As we said in the mission statement of my former team in DC, healthy bodies and minds are the foundations of academic success. I just love that. And conversely, as you heard from Dr. Atisha earlier, we know that missed school is often a symbolic of unmet health or social need, that pediatric vital sign. And I heard that all the time working in schools from school colleagues, that they had so many young people missing school because of a health condition that wasn't fully managed, because of a lack of access to mental health services, because of a social need like food or housing insecurity. And those schools were banging their heads against a wall, often up against lack of time and resources, and also feeling like, as I know is familiar to this incredible community on Zoom, that the school was expected to try to solve all the problems in the world that showed up for families just being left on the front step of the school, rather than really trying to focus on their core job of high quality instruction. And that was particularly striking because as I entered the world of school health, not only was I amazed by the breadth and depth of health and social supports happening in schools, but also how many of those supports overlapped with very similar outreach that we were doing in primary care. We were sometimes supporting the same families with the same issues impacting their attendance and academics, just in silos. So I love chronic absence or attendance because we can partner together as sectors to address those health and social barriers, to position that child to attend regularly and be successful in a more efficient, a more aligned, a more family-centered way, and using attendance or chronic absence as a clear shared indicator of success in that work. Like a really big cross-sector partnership with a clear success. Is that child in school regularly or are they not? So that's one side. I think the other direction of that health and academic relationship really resonates for me too, that we know, as Dr. Atisha said, chronic absence or regular attendance success in school is one of the leading predictors of long-term health. And so if it is, as a pediatrician, if I want my patients and families to be healthy in the long term, I have to attend to their academic engagement.
So can you give, and I think we're going to ask for the slides to come back up, but can you give us a couple examples of really successful partnerships between pediatricians and schools, and how they work together?
Yes, I wish I had 3 hours for this part of the presentation because there are so many good examples happening across, but I'll try to pull a few that I think represent different types of partnerships and leveraging different assets. So this first example is from a children's hospital in a school district in Washington, D.C., where I trained and did a lot of my work. And there, a group of folks recognized that not only was attendance a place where healthcare could play a supportive role with schools in addressing absenteeism, but also where we had a data sharing infrastructure that could allow real-time data sharing around absences. So at DC Public Schools, and this program is ongoing, families were and are able to give consent for their child's attendance data to be shared with their child's pediatrician securely through the health information exchange. That's the same health information exchange through which hospitals share data. And that allowed a regular feed, secure data feed to flow from the student information system at DC Public Schools to those pediatric offices at Children's National. And then we recruited and trained those pediatric offices to do outreach and follow-up to say to these families, is there a need? Do you have a need for an appointment? Do you have a need for medication adjustment, for a mental health referral, et cetera? And really try to close the gaps for families that they may be facing. That's kind of a big system, urban setting, kind of big data. The next example, if we go to the next slide, is from my current work here in Vermont. And I want to just give a shout out. I see some of my awesome friends from across Vermont, including some members of the teams from these pilot communities. But this is kind of leveraging the unique assets of rural, smaller communities where relationships are really what drives the work. And we may not have access to huge, big data sets, but we have access to a whole lot of great relationships and real infrastructure at the community level. So through a generous grant from the Leahy Institute for Rural Partnerships at the University of Vermont, we are funding 4 pilot communities, a school district and a pediatric practice in each of those communities. You can see them noted with stars here in red. The blue is where the University of Vermont is, where I'm based. And in each of those communities, we're really developing shared resources and routines to partner. So this includes implementing screening for missed school and primary care, enhancing multi-tiered attendance policies and protocols within the schools, including layering them on MTSS structures, hosting shared events where it's the school and the medical home or the healthcare partner promoting attendance together, both maybe with unique trusting relationships in the community, and really building communication and coordination routines between the healthcare and school partners. In a few communities, that includes updating FERPA and HIPAA consent protocols, our favorite topic, I know, and having school nurses and representatives from the medical home as regular partners of those schools' attendance teams, so that they are on the front lines together, identifying trends and responding to missed school together. And then my last example, if you go to the next slide, is about school-based health centers, which I think we might talk about a little bit more as we move through the rest of this time together. But school-based health centers, I think folks are aware, are essentially medical practices that sit within or adjacent to a school. And they can be a great way to ensure that young people's, and sometimes even staff or families' health needs are met without having to leave the building. There are a bunch of places looking at the impact of school-based health centers on attendance, but this is an example in these slides from a big set of rural school-based health centers in upstate New York. Bassett Healthcare there operates a number of school-based health centers, and they were able to evaluate the school level absence rates in schools that had a school-based health center and those that did not. And they found that overall school-wide chronic absence was less in schools that had a school-based health center than those that did not.
So if you are wanting to involve your pediatricians in your work, what advice would you give to a district, a school who thinks that's important?
So I think my biggest piece of advice is to start with your in-school health folks. So as Kim was mentioning, really leveraging your in-school health folks. That might be a school nurse, a community health worker, a school-based mental health team. Not just thinking of them, as Kim was saying, for Band-Aids and maybe some medication, but really leveraging their full healthcare expertise. I often hear that folks bring in school nurses, as you were saying, Hetty and Kim, when, say, it's a kid with known medical complexity, a kid with chemotherapy. But when we leverage school nurses or school-based mental health folks or others within the school community as part of the attendance team, you just lift up a different way of thinking about what might be a root cause, what might be a uniquely trusting relationship, what might be resources that are out there. So step one, I would say, is to really think about your in-school health folks and leveraging them fully. They often are also a nice conduit to outreach to community-based healthcare providers, pediatricians, family practice, et cetera. And I think my gut on this is to say to start small and to wonder, your school nurses probably know this already, is there, say, one or a handful of primary care practices with whom your school or district shares the most students? And start there. If you know them already, great. If you don't, sometimes a really simple intro meet and greet can make wonders, make magic happen from there, just to have a personal relationship. This is relevant, I think, in big communities and smaller communities. Meet one another and wonder about shared goals and opportunities. There may well be resources in the primary care space that can complement resources available in your school setting. And at least there's an opportunity to try to deduplicate. So you might be on parallel tracks, but really thinking together. Again, with my starting example, might there be families served by your school and your healthcare community who are being served for some of the same stuff? Sometimes a simple meet and greet and maybe a standing monthly huddle or quarterly huddle can be a way to get at that. And then I think my last quick piece of advice would be, like, as you're approaching community health providers and teams, you don't have to know all the answers. You don't have to come in with an ask, but just to start with a relationship and to wonder together what shared goals might be, I think it can really help build sustainability.
Heidi, I'm going to actually ask everyone to come and we're going to engage in a couple of cross-cutting discussions. While they're doing that, I want to ask you, I think that was Project Care that you talked about in DC, and some folks, I think, wanted a one-page PDF. Maybe we can make sure that we provide a link to Project Care.
Yes.
And they actually have a great toolkit and resources.
Definitely.
So that's one quick little aside. Maybe we can do that in the chat. One member of the attendance works team, if you could just go on to that. But I actually wanted to go back to Kim for a second. So someone put into the questionnaire, they said their school nurse is used exactly the opposite of what you're suggesting. What's your advice? And then I actually wonder about whether Chelsea or Beatrice have advice on that too. Starting with you, Kim, what's your advice to someone whose school nurse is actually not being used for that prevention tier 1 and universal supports that we're asking about?
The first thing I would recommend is the school administration or school staff, do they understand the current licensure of the nurse? Nursing, school health and school nursing is a very crowded place. There are RNs, there are LPNs, there are advanced practice RNs. We're all nurses, but we all have very specific scopes of practice, and some of which are broader than others. And a nurse is a nurse is a nurse is not necessarily a nurse. So when you're hiring, NASN identifies a school nurse as an RN, as they can practice independently. LPNs do need to practice under an RN. So it's also a specialty practice, and you only know what you know until you know something else. And it's not, you can't just step into a specialty practice without having some additional resources and support. And often we see nurses just coming into schools, there's no orientation, and our supervision is often non-nurses who may not understand the role. So identifying that community of support is very important for the nurse, and identifying and having access to those evidence-based resources, which may be a local or state level association or the national association, and not only having the nurse, allowing the nurse to explore the bigger picture, that they're brought into these meetings. They're seen as a valuable staff member. They have more to give.
Thank you, Kim. I'm curious from a district perspective, Chelsea or Beatrice. Beatrice, looks like you're ready to go. How do you get people to think more broadly about how they use their nurses?
So with us, it's all about the job descriptions, right? And so our nurses are at the sites, assigned to the sites 1 to 2 days out of the week. The impact for us comes from the health aides. These health aides collaborate or are supported by the nurses, and it is in the job description that they need to support students with all of these different entities that we discuss. But even more than that, we also have free Hazel Health or Teledoc, if you want to call it that, for our students. So that's really helped a lot. So a lot of these minimal, if you want to call it, health needs are taken care of by a virtual doctor. And so we obtain permission from the parents. And so if they need like aspirin medicine, or they just have a headache, whatever, they're able to see a doctor on the spot virtually. So that's what it looks like in our district. And again, from an admin perspective, everything's on the job description as far as how the needs are met. And so we have a strong board that ensures that our students' needs are being met. And like I said, a lot of it is in collaboration with the health aides. And of course, we take care of whatever we can with our teledoc option as well.
Thank you. I'm actually going to shift for a second to a different question. I have one for Heidi and then a different one for Chelsea. Heidi, folks are worried about doctors who what they keep doing is just sending lots of excuse notes so that kids to miss school. How would you address that issue?
I love this question, and it is real. I'm going to drop, as soon as I stop talking, a link into the chat for an interesting perspective piece that a fellow pediatrician published recently on excuse notes. I think the biggest thing I would say is doctors write excuse notes, in many cases excusing prolonged absences, et cetera, because they don't understand the impact between missed school and long-term outcomes that so clear. So when you get an excuse note like that, I would say my biggest suggestion is to reach out to that provider and wonder with them together, like, can we share a little bit about the impact of the missed school for that individual or our community? Can we sit together and think about a different protocol for excuse notes, et cetera? I would assume not malintent, but just misunderstanding. We are doing education through the American Academy of Pediatrics on attendance. Dr. Atisha and I are really involved both with that. But that work is slow, right? It's hard to get a national sort of top-down educational effort out. So I really encourage folks to reach out individually to those practitioners if you feel comfortable. And your American Academy of Pediatrics chapter is a resource for you too if you need help with that connection.
Great. Chelsea, there was a question, and I was thinking because you do so much around behavioral health, but what are the scales, tools to do these behavioral health assessments? Whether it's about school refusal, school functional behavioral assessment, how do we know? Like I was working with in another place where I had this associate principal who talked about how the principal decided that they were going to require all the kids to show up to school if they wanted to go to prom. And all of a sudden, you had these kids who had been not showing up to school for days, all of a sudden wanting to come to prom, but still not wanting to go to school because their parents said they had anxiety. How do you assess that situation? What are the tools?
Yeah, so I think there's official ones and there's unofficial ones, right? So we think of this in the tiers as well. This is where school nurses are critically important. The school nurse knows the kids that they see all the time. So even just teacher report and things like that. I will say in this is free if your district can make it. We use a risk dashboard, and we have it for academics, and we have one called for behavior. And that risk dashboard combines tardies, absences, retain, failing grades, and discipline incidents, OSS and ISS. And it basically comes up with a weighted score. And then schools that report can be filtered top down, so you can see your kids that have kind of those highest risk factors. And the best part about that is you can see them going into the next school year. So we can flip those reports now, so you can see your incoming 6th graders, your incoming 9th graders that have that kind of combo score to tell you that something's going on. We use functional behavior assessments. We are lucky here in APS. We have some gen ed BCBAs as well as our special ed BCBAs. So the BCBAs do lots of functional behavior assessments. We do look at attendance as a behavior. And then we do not use the school refusal assessment scales. I have seen districts use them. We are fortunate we don't have as much school refusal as I think some other districts may have. But we also are not scared of moving towards psychological evaluations in that space if we feel like we need more information. So low level gatherings, and I'm happy to share a screenshot of those risk reports and the formula behind it if anybody cares. Happy to share those, but that's FBA.
And if Chelsea, if you could mention, share that the free resource that you mentioned in the chat, that would be fabulous.
Yes, I can share the formulas.
So there's also a question from Brittany. She says, we know not everyone can get to the doctor each time their kid is sick. Our school doesn't have a school nurse. Within our school, is there a resource we can connect our families to who may not have access to medical care or multiple kids and are having difficulty bringing each doctor, resulting in unexcused absences due to the inability for them to get documentation when an illness is happening at their home?
I mean, I can jump in on this. I do think there's a question. We're actually having a lot of discussions in Vermont on this right now, where our families, especially those in more rural areas, the children have to travel a long distance to get to school and to get to healthcare, but caregivers are often traveling maybe in the other direction an hour or more to get to work. So I think the concern about access to healthcare is real. I think a few different things, some folks use mobile health units as one resource, although that requires resources too, financial resources. Telehealth, I think, may be a real resource to consider for communities like that. That takes staff time at the school, that takes facility space, like a confidential space, but telehealth has been a very effective strategy in connecting young people who may have trouble getting to physically a provider or a mental health clinician.
I also want to put a point that was in the chat that I also noticed. So some schools have to assess when do they really require doctor's notes too.
Yes.
Sometimes we are creating a barrier by saying you must have a doctor's note versus a parent being able to say my kid was sick or have other ways. So I do think that's a really important thing for people to take to look at. I also wanted to mention again that Elliot had put together those flyers, and folks, we're pretty much back to pre-pandemic, unless you are really sick. You've got a fever, you've got, seriously, kids should be generally coming to school because the routine of school is so important. And I do want to say that I think that's one of our challenges. I'm curious about, have you all seen any successful efforts to help reestablish that the routine of school just matters for kids' well-being and learning? And how can we sort of post-pandemic, 2 years down the line, I feel like we're 3 years, we're still combating preconceived notions of attendance or the not importance of attendance, even though the pandemic is now a couple years behind us.
We do a lot at the school district with, I'm sorry.
No, go ahead, Beatrice, and then we'll go to Kim.
No, at the school district, we do a lot of FOMO events, the fear of missing out events. And right now, especially with testing, and that's really helped to get kids here because they don't want to miss the surprise glow party, or, we try to do a lot of free things, recess, whatever it is, but that just really heightens the importance of being present, at school and so on and so forth. And the kids have really, really latched on to those events. And I think because I'm a cluster lead as well. I don't know if I addressed that at the beginning, but my schools are really, really big on attendance and just making sure that the kids know that if they miss a day, they're going to miss out on something potentially great. So we do a lot of that, and that's really helped. And as simple as it sounds, it really has helped.
Yeah, creating engagement. Kim, 30 seconds, because I want to then turn it over to Kwesi.
In our current study, looking at chronic absenteeism and the role of the school nurse for the case management process, we have seen results from the 7-year study of school nurses getting students back to class from those engagements, from that outreach. So there are changes, there are ways to do it. They're not necessarily easy, but they are worth it.
Thank you so much. I'm going to turn things over to Kwesi. We will get PowerPoint slides out to everyone, by the way. I know that question keeps coming up. Kwesi, why don't you take it away? Some thoughts, reflections.
Well, thanks so much to this panel. Just great. I think, Heidi, you really, in your remarks, summed it up best. Healthy bodies and minds are the foundation of academic success. I took note of that, and all that we've heard that backs that up kind of gives us a sense of what's required to get that. And we need partnership, we need partnership, we need partnership, we need trust, we need trust, we need trust. And that starts with building relationships, and when you have partnerships and trust, then you open the doors to creativity, to taking chances, to finding the right team, the right staff with the right mindset, focus more on problem solving and collaboration, where someone said there are no barriers because they've got a team with the right mindset, and where they need supports, that you guys have provided capacity building to support collaborative behaviors. And we know that collaboration is a capacity. Some people have more capacity, comes more natural than others. Others need some supports to be put in a better position. And the result is, in terms of the data, the research, documentations, everyone benefits. The kids benefit, the teachers benefit by having fewer challenges to address. Coordination is just more efficient. I think it was Hadi that mentioned breaking down silos, that communities get more bang for their buck when we work together and break down silos. And so this has been just a wonderful conversation. I really want to thank the panel, and I think you can go to the next slide if we're getting ready to close down. And we definitely want to make sure that you promote the campaign here today, ready for tomorrow. We've got 2 more webinars in the series. We'll share key resources. Everyone will get a link to this webinar, whether you participated live or for those that didn't, they'll get it as well. You can go to the next slide. You'll be able to see Hetty and Company and so many other partners at our conference in a couple of weeks. We've got 3,200 plus people coming to Minneapolis at the end of this month for the National Community Schools and Family Engagement Conference. We're very excited about that. And we will be addressing all of these issues in some way, shape, or form, especially chronic absenteeism and family engagement at the conference. Not too late to register. Next slide. Already mentioned, we will post a recording within a couple of days of this webinar, and you can find all of the previous webinars on the same link. Next slide. Please let us know how we can improve. There's always room for improvement. You can use this link. We'll send you a link through email. You can also, if you want to do it immediately, you can use the QR code with your phone. And we want to thank you. Next slide. Special appreciation to our philanthropic partners, Heising Simons Foundation, the Overdeck Foundation, and a range of individual donors. Next slide.
I think that may be it.
Maybe the last slide. I think you can, Jaden, you can bring thanks to Jaden and the Attendance Works team, all the staff that made this possible. I think you can bring everybody back up. Thanks to Elliot, Kimberly, Dr. Gonzalez, Chelsea, who's made a lot of fans today, according to the chat. Heidi, I think you all have lots of fans, so we're really so blessed to be in partnership with all of you, and we just got to keep doing this work. Now more than ever, we need deep partnerships, collaboration. That's how you deal with high levels of challenge, by working more closely together.
And Quincy, I would just add the other thing I think you've seen in all of the examples, Beatrice, Chelsea, Heidi, Kim, persistence matters. These are not easy to resolve, but when we have the will, the commitment, the persistence, we can see those slow but steady improvements. And we saw that in the data. And I think we got to be prepared for that. This is about the long term, the long haul, and relationships don't happen overnight.
Indeed.